If you have a student with a bleeding disorder in your school, there is specific information you should be familiar with to help him or her stay safe and healthy. A bleeding disorder is an inherited condition where a person doesn't have enough of or is missing one of the proteins that causes the blood to clot. This means that a person with a bleeding disorder takes longer to stop bleeding. The two most common types of bleeding disorders are hemophilia and von Willebrand disease, and each has varying levels of severity. The majority of bleeds occur internally in areas such as joints, muscles, or soft tissue. Because most bleeds are internal, you may not recognize that your student is having a bleeding episode. The common symptoms of bleeds are aching, tingling, bubbling, cramping, throbbing, and feeling of warmth in the area of the bleed. Life-threatening bleeding occurs in the head, eyes, neck or throat, abdomen or stomach, kidney or bladder. Bleeding disorders are treated by replacing the missing clotting proteins through intravenous infusion or nasal spray. Many people with bleeding disorders take medication prophylactically, which can reduce bleeding episodes. However, even with medication, bleeds can occur and should be addressed. Bleeds can be quite painful. It is important that a student who says he or she is having a bleed or describes any of the symptoms gets immediate appropriate medical treatment based on the student's individual health plan. You are probably familiar with the various legislative acts which help you care for your students with disabilities, including bleeding disorders. Each student should have an individual health plan, IHP, and may need a 504 or Individual Education Plan, IEP. These plans will cover specific treatment, approved physical activities, needed accommodations, and disclosure. The student's parent may wish to schedule a meeting to review these plans with the teacher, the school nurse, the student, and ideally with the student's hemophilia treatment center nurse. Some students may be very open about disclosing information about their bleeding disorder, while others may be more private. It is up to the student to decide how much he or she wishes to share about his or her bleeding disorder with the rest of the class or school. Whatever the decision, it should be respected and upheld by you and other school personnel. Students with a chronic disease are 30% more likely to be bullied. For students with bleeding disorders, anything that makes them appear different, such as not being able to participate in certain PE or recess activities, makes them a prime target for bullies. Be aware and take action. Having a student with a bleeding disorder can be daunting, but don't be afraid to let your student be a kid. Most children with bleeding disorders, if receiving good medical treatment, can be just as active as other children. As with any of your students, normalcy should be the goal. For more school-related information and other resources about bleeding disorders, visit www.stepsforliving.hemophilia.org.